So this kind of concept of maybe cytokines maybe being able to cross membranes and activate immune responses in other parts of the body, maybe over a lifetime, is it such a different pathway that it just still does not count as chronic inflammation in your opinion?
Well, again, the same cytokines that might be elevated in chronic inflammation are the one that might drive the anti-cancer responses, right? So again, as I mentioned, it's more about continuous background versus a peak and then contraction of that inflammation. So I think that's a critical aspect. The reality is that we don't know which are exactly the key mediator of the chronic inflammation that we should target, because again, as I mentioned, is double-edged sword. You don't want to block for too long and too intensively the same factors that might be the one leading to the anti-tumor efficacy.
Mhm. Were there specific biomarkers or immune signatures discussed that could help clinicians recognize when inflammation and aging are likely to impair benefits from immunotherapy?
Yeah, no, absolutely. So I mentioned that ferritin, IL-6, platelets, ESR, erythrocyte sedimentation rate are easily obtainable, um, relatively inexpensive biomarkers that should be used for this goal. Um, and then, of course, there might be others, but they become therapy and disease specific.
Interesting. Let's talk a little bit about mechanistic and translational insights. What mechanistic pathways linking sex, aging, and chronic inflammation to immune responsiveness stood out to you as the most actionable for drug development or trial design?
Yeah, absolutely. So I think I briefly mentioned earlier. I think a very interesting one is the um, basically the blockade of sex hormones. So we already have those drugs available for example, for prostate cancer, from breast cancer, and so on. So they are readily available, commercially available, and so you could think about combination trials where you can block those pathways to boost a cancer immunotherapy. That, as short term, I think, is um, the most actionable one. So aging is critical because we do have biomarker of aging. There are even preclinical studies that develop CAR T cell therapies that can target senescent cells, right? Killing the senescent cell. But obviously the implication for toxicity and so on, like it's like the whole concept of rejuvenation, it's really hard. We know that the oxidative pathways, for example, are important, but I don't think we're to the point that we have clinical grade products that we can say that might be improving cancer immunotherapy right now.
Interesting. Even speaking of like things like oxidative factors, I think about like how oxidative stress is more present in some people. For instance, people who are neurodivergent tend to be more prone to oxidative stress. I'm wondering if measuring likelihood of oxidative stress has come up at all in any of these
Yeah, we
conversations.
didn't specifically talk about that, but I've been thinking a lot about this topic, and I think it's a very interesting one. The reality is that yeah, we might have some biomarker, but it's not that established, right? You don't have like a clinical grade oxidative signature, uh, but we're thinking about that, and
Mm,
we're trying to develop that.
wonderful.
And again, one thing that I want to mention is that I think a very interesting talk was about exercise, and there is a whole field of medicine that studies how exercise can affect cancer immunotherapy. And um, again, the reason why we invited a speaker to talk about that was that it's something that typically we don't discuss about. And so it turns out that if you do even short-term exercise, you mobilize NK cells and T cells to the peripheral blood. And if you use those cells to model cancer immunotherapy in mice, they actually do better than patients that don't do exercise. So imagine now you could hypothesize, and actually there are trials ongoing where you can have the patient or the donor of the immune cells, if we're talking about an allogeneic therapy, exercising before the therapy. So you're basically preparing the immune system to be activated, to be in the peripheral blood so that when you do the immunotherapy, they're going to be super active. Of course, this is a little bit of speculation here. We don't have a lot of data, but I think it's fascinating because again, sometimes we think about very sophisticated, expensive drugs, when at the end of the story, maybe just exercising could change dramatically your cancer therapy, or diet. There was also a speaker talking about diet, and we have done work on the microbiome and diet that also we presented here at ASH last year. So again, I think it's a exciting field where we can modify a lot of our lifestyle factors and potentially improve cancer immunotherapy.
Mhm.